to understand the patient's expectations, because there is uncertainty in complex functional structural cases. But if there's any element of aesthetics, any element at all, then yes, that's non-negotiable. Because I don't think, well, I'm not a specialist in psychology. So, and so the people I work with are specialists, not just in psychology, but in body image psychology. And, and they have an understanding and see things in a different way that's complementary to mine, but have an understanding that and an expertise that we can't have as surgeons. I think the other thing too is it's a little bit like reconstructive plastic surgery. Ideally, you have one person doing the resection and one doing the reconstruction. And the reason you separate is so that the guy doing the resection doesn't compromise the resection to make his reconstruction easier. And so if you therefore have someone who's not invested in the potential reward and excitement of doing the surgery, they won't be that element of bias is taken out. But you do have to be very sensitive. Well, firstly, I hope I convey that if you see this as a hurdle you've got to do, then that's not the right way to see it. It's not just, okay, if I've got to, I will, because it should be perceived, and I very much hope it is, as being in their best interests in helping them, as we said earlier, put into words exactly what they hope surgery is going to achieve for them. It's not just, well, I'll feel better because my bump's not there. It's about articulating why you hope it's going to make you feel better. So plus, there are things that are helpful about adapting to change afterwards. We know that it takes time to adapt to looking different. And sometimes that can be disconcerting. And the more we can understand that individual patient, the more we can help them and achieve a positive experience rather than just a less negative experience. So I think these allied things really, really matter. And if we miss something and we operate on someone and we think it's a good result, but the patient doesn't, then that's a situation we all find a very difficult one. And we don't, and revision's not the right thing to do, but a patient may feel, crikey, you've got to operate because you haven't achieved it. And it's, and that's not good for anybody. So, I think if you put your patient's best interest first, that specialist psychological assessment is really valuable. Really positive, I think.
It's kind of weird for me listening to you because I'm getting this jealousy that I used to have on the British Olympic team, where they've got such a holistic approach, and then we're in Africa and we're training and we don't have that incredible support system. I think it's fabulous, eh? Okay, so
I guess we're really lucky, aren't we?
Two last questions, because there's so much information you've given me. I'm frantically making notes of what I want to add to my practice, etc. Two questions to finish, bringing back to the sporting analogy. Say the one moment where you're like going the Alpe d'Huez, and you break. Yeah. When was that one moment when things just fell apart and it was a really bad result or something didn't work out with the patient? And the other one is the time that you actually got to the top first. That great moment.
Yeah, you asked the difficult questions. Definitely, Cameron. So the disappointing, well, I guess, we probably, if we're really honest as surgeons, there's probably not a single, I rate my results 1 to 5. And it's easy to do that on a database. I've never clicked 5. So I have clicked a few 4s, which is great, but I've never clicked 5 because you look and there's every time you think, do you know what? 1 more millimeter here or just a little touch there. So, but it's when that becomes unhealthy that you don't get to the top. It's when you beat yourself up and you think, I just don't want to. It's that fear of failure. I don't want to take this on anymore. And that's when you've got it out of proportion, and it's that judging mindset which is unhelpful. When they talk about pessimism, which is a downward spiral, it's that thing that it's personal, pervasive and permanent, so when it doesn't work out, you say, well, it's my fault. So it's personal. If it didn't work out this time, it's not going to work out next time. So that makes it permanent. And it's not just in rhinoplasty, it's in the whole of my life. It's pervasive. So clearly that's unhealthy. And that's when it's good to have a beer with you and others to say, for goodness sake, your results are fine. So I guess it was just cumulative rather than one horrible incident. But equally, you don't know when the other moments are going to come. I saw a woman yesterday who I operated on a year ago, and she's really happy with the result. And it was one of the patients I'd first operated on in the new hospital I work in near Sloane Square. And at the end of the operation, it was just that gleaning, quiet satisfaction thing. And a nurse just looked and smiled, and that no more was needed to be said, and it didn't bleed, and the tissues just did what you wanted them to, and you weren't aware of the passage of time. It just, and so I try to visualize that now before every new operation. So I guess that is a bit like at the top, isn't it? And you turn the wheels, and the bike moves, and you're not screaming for oxygen. And I guess that's when it's nice. And I guess to some extent, that's why the real finesse rhinoplasties are the ones I enjoy the most now. When yes, you've got plenty to lose because they're not horrible, ugly noses, and you really want to get it right. And that is a more personal challenge for me than a rib reconstruction fifth redo, which I just don't think my personality is right for. And so that's when I would say, do you know what? There are others who are really great at that and they really enjoy that. Whereas for me, the challenge comes in other areas.
Yeah. Julian, thanks. It's so inspiring. I'm sure the listeners around are going to be commenting a lot about this. Shout out to Carl Stortz again for bringing this program to us. And personally, absolutely, thank you very much for today. It's been a scintillating 35 minutes of listening to you. Last question. Sure. If people want to come and visit you in London, is there a possibility for like an observership or anything like that for people to reach out and come and see what you do?
They're very welcome to get in touch. Through the website is the easiest way. It all depends on what's happening. It's a challenging one for me because if we're talking about performance again, distraction is one of those elements that takes away from performance. So sometimes people come in and I say, look, please don't ask me any questions. Don't talk during, because let's talk at the end, and that's great. But yes, it's lovely to learn from others as well. You and I need to have a beer and talk, and you can tell me about performance and Olympic level of performance. So, it's a great joy to learn from others. So, and just do get in touch. I can't promise because, it depends on other things. But yeah, I'd love to hear from people if that's what they like.
Well, on behalf of all the listeners from the Rhinoplasty podcast, thank you so much. And we hope you get a couple of fives in the next few weeks.
Cameron, you're such a star. Thanks so much. Take care.